welcome to the Emergency and Trauma Center at the Medical Center. For patients entering by car or by POV or by walking in, this is something a little bit different that they're going to see when they come in. Patients will walk up to the registration area and they will be checked in by a registrar. At the exact same time, they'll actually have a acuity, which is taking a look at the patient to see how sick they are, done by an LPN or an RN that will be at this desk. At that point in time, you'll go into one of our other rooms to have a medical screening exam done. When you enter into this room, a registered nurse will do a brief assessment, check your vital signs, and probably even do a focused exam to see what your actual complaint is and to see what your status is. At this point, she will make a decision as to where you need to go within the department. There's actually 3 different areas that she can go to within the department. The first one is our rapid medical eval unit. This is one of our typical rooms. Patients will come in, and this is where you'll wait for your provider exam. Once you're in this room, you'll stay in here for a maximum of 90 minutes, or even sooner, you'll actually be moved to one of our results lounges to wait for your results from your test. This is where you'll see most of our urgent patients will be seen. If you come in and you're actually an emergency type patient, you come in with chest pain, stroke-like symptoms, congestive heart failure, things like that, you'll actually go back to one of our acute care exam rooms. We have 23 acute care exam rooms that will be operational on March 3rd. This is one of those acute care exam rooms that I was talking to you about earlier. This is actually our cardiac monitor where the nurses will be able to see you. We have a nurse at a central station that will be able to watch what is going on with your heart rhythm and your oxygen and your vital signs. We have things for suctioning, things for the physician to check your eyes and your ears, and if you needed any oxygen or anything like that, you'll be able to have that provided. We also have a new nurse call system for you to be able to access your nurse, so you won't have to come find her. You actually be able to press the button. And then they also have flat screen TVs for you and your family to watch while you're waiting for your results to come back. If you arrive by ambulance or by helicopter, you'll actually come into a separate entrance on the east side of the new Emergency and Trauma Center. For trauma patients that are coming into the medical center, you're actually separate from the rest of the population. You'll go to your own separate area of rooms. This is a typical trauma room. You'll see we have larger cardiac monitors. We actually have surgical lights, and we have surgical booms. These things hold like our oxygen, our medical gases, and our suction. And we'll be able to, as you can see, compared to the old trauma room, have a lot more space to be able to take care of you if you're in a traumatic incident. 100% of the patients that come to the new Emergency and Trauma Center, 100% of the trauma patients will actually have a CAT scan done. The nice thing about the new trauma center is that we actually have our CT scan right next door to the trauma room. This is very important for our patients because CT can be a life-saving mechanism or treatment for our patients to figure out what is actually going on with them. You won't notice the new CT machine in here today because we're doing this before we actually open, but it will be operational before March 4th. At the new Emergency and Trauma Center at the Medical Center, you'll see numerous differences as a patient and a family come into the facility. As patients come through, we actually have them separated into 3 different areas. We have a rapid medical eval unit that is used to treat our urgent type population. We also have acute care rooms that you'll see for some of our emergent type patients that come in. Those rooms are all private, have TVs and doors on them. And then we actually have our trauma area that's 6 rooms in there, 2 of which are pediatric critical care. The environment is much different with very warm, colorful colors and more inviting for our patients and for their families. At the new Emergency and Trauma Center, the whole design has been placed around placing the patient at the center of the process, the patient and their family, so very much a patient and family-centered care. At the Medical Center, although we would like not for you to have to come and utilize our services, we do look forward to the next time that we'll be able to serve you and your family.